Well, to be named a Castle Connolly Top Doctor in 2024 is a fantastic honor. I don't take this very lightly. I think it's great to having been nominated by my peers. It lets me know that my hard work and efforts to help care for our patient population here in Chicago is not going unrecognized. I think the fact that I was nominated by my peers for this award, it's very important. It actually makes me feel really good to know that my fellow colleagues, have an understanding and a recognition and appreciation for the work that I do, because they know that it is genuine and heartfelt. Well, I initially decided to go into medicine and pursue family medicine actually as far back as age 6. I've always had a fascination with the human body. I think it's one of the greatest machines ever made. So I've always had a fascination with how the body works, but also the interpersonal relationships that a physician gets to have with their patients. It's definitely an honor to be able to work with patients not only when they're healthy, but also when they're not at their best. And I think that is a privilege and an honor to be able to do that. I think the patient experience here at Oak Street Health is fantastic. I always like to say, it does take a village, right, to actually help care for our patients. One of the great things here at Oak Street Health is that when the patient comes, it's not just them coming to see me as the physician, but it really is a dedicated team of individuals that are here to help care for the patient, whether that's our welcome coordinators, our receptionists who are greeting them when they come into the door, our hardworking nurses and medical assistants, from our social work team, behavioral health team. It really does encompass an entire family atmosphere. And the patients are able to pick up on that and comment on how much they feel like they're at home when they come here for visits. Well, some advice that I would give patients that are trying to navigate today's complex healthcare system is one, first and foremost, realize that we are here to help you. We are on your side. Two, don't be afraid to ask questions. I know a lot of times patients, don't want to act as though they may not understand, their condition or terminology, but I always encourage patients, feel free and feel open to ask as many questions as you need. I like to encourage patients as well to bring a notebook or even bring someone with you to your appointments to help write down information. That way we can foster a stronger doctor-patient relationship. Well, I think the future of medicine with regards to the patient-doctor relationship, I think now more than ever, is we're actually going to be more dependent on each other. I really hope and pray that patients and physicians will continue to strengthen their bond with one another, whether that's through in-person, face-to-face communication, or even with the incorporation of more modern medical technology. But I feel at the end of the day, there's still no substitute for a good patient-doctor relationship. Yes, I think there's significant importance for raising up our next generation of physicians, particularly for those that are in underrepresented minority groups. I have a foundation that I've been volunteering with for over 6 years now that actually helps to increase those efforts. Let's face it, the face of the American population is changing. It is becoming more diversified. And studies have shown, and I've heard from patients myself, that they feel oftentimes more comfortable and more at ease when their physician comes from a similar background or looks like them. So I am definitely a strong proponent for helping to increase the numbers of underrepresented minority students in the healthcare field. I've had many experiences, both good and bad, but mostly good, of course. I think as a Black physician, I think one of the things that just brings me a lot of joy is seeing the smiles on my patients' faces when I walk through the door. A lot of them are kind of shocked and surprised that we actually look the same. And I think that's actually a great thing for a lot of patients to be able to have that opportunity. There is, kind of this unwritten rule that there's a little bit of ease, and they understand the burden that comes with that, whether it's with their cultural background or things that they may have experienced, whether that's discrimination, racism. I've also experienced that to some extent as well, and it is kind of a common ground from which we can build on.